Hello, everyone. Welcome to the Y and E podcast. Thank you for joining us. And if you haven't subscribed, please go ahead and hit the subscribe button, like, share, and engage us in the comment section. So, I saw a story on X today, and it's a very touching, sad story of a man that died at the age of 48. What contributed to his demise was the fact that we have no working healthcare system in Nigeria, a system whereby anyone, whether you're wealthy or poor, can have access to in order to get the necessary care that they need. And this is one of the things that makes Nigeria a third world country. As hard as it is to digest, as hard as it is to even hear, to even think that the most populous black nation of earth is struggling with, you know, providing good health care, providing basic amenities for its people is just unfathomable. And it is sad. So this man looks like he's a doctor, he's cardiologist, relocated abroad because of the healthcare challenges in Nigeria. And when his doctor relocated, the his health started deteriorating until he lost his life because he couldn't get the right care that he needed.
I mean, it's a very sad one. It's a very sad story, especially if the deceased or the person affected is close to you. If he's not that close to you, you might not actually feel it, but this is a very touching story. I think for the most part, most people believe that healthcare should be a human right. It should be a right, to be able to access healthcare, whether it be in the US, in the UK. Well, in the UK, I think they have an NHS, which is basically free, but I think that has its own issues. UK and Canada, their health system, because it's free, it takes time to see a doctor, for non-emergency cases, unless it's really, really emergency. But I think, yeah, what most people believe accessing healthcare should be a right, especially Bernie Sanders, he believes that healthcare should be a right to every US citizens. But taking it back to Nigeria, we know that the healthcare in Nigeria is nothing to write home about. The politicians, the leaders, they do not pay attention to it because, quite frankly, they don't use it. Whenever they get sick, they get fever, malaria, headache, migraine, they have access to private jets, to, presidential wing of the of the airport. They just fly, to US, to London, to France, as the case may be. So I think due to that, they do not see the need to fix our healthcare system. And quite frankly, for me, is sometimes I think of going home, but I also think about what if somebody in the middle of the night begin to have like a medical emergency? What would become of the person's fate? And coupled with all of this news, it reinforces those beliefs or those thinking. I think our political class, our politicians should pay attention to our healthcare system. People should be able to access healthcare whether paid or free. People should be able to get quality healthcare. Also, our healthcare professionals, the doctors, the nurses, I think they should be compensated appropriately. If they are being compensated appropriately, I don't think people will be jackpying for a greener pasture. And then also, for people studying healthcare related majors, I think government can also step in to subsidize fees, how much it costs to train them, so that the parents or the individual that is, paying out of pocket will not really feel too much pressure in their pocket, to go through the training. And I think these and other things that they can do to ensure that the trained doctors stays in the country to practice in the country and make the field and then the job attractive so that they can stay.
Yes, I definitely agree with all the recommendations that you've put in place. And it's unfortunate that doctors they spend so much time, so much resources to become certified, to become a practicing doctor, and they'll graduate, start attending to people, and they won't be able to take care of their families because they are not being compensated fairly. So their next move is to look for a greener pasture. And currently, many hospitals in Nigeria, many government owned or government run hospitals are on strike because the doctors are not being paid properly. They don't have access to all the necessary equipment, the tools that they need to be able to take care of the Nigerian people. And this is sad. This is 2025. We're still talking about the challenges that we've experienced 20 years ago. Many people still experiencing it today. And people with means will find a way to go to a better functioning environment in order for them to at least be able to enjoy a little bit of life that they have left in them. And this is not good at all. And we're talking a few minutes ago that the people that enjoyed Nigeria were born around the 60s or 50s, and they're approaching their 60s now. So they've enjoyed the country so much. They went to free schools, they had access to good healthcare, and since then, everything has started going down. And you're not truly interested in fixing the economy, in fixing and providing basic amenities needed for people to survive. I saw a clip online recently, and it says that a Nigerian is basically one diagnosis away from being broke. Even if you've struggled, you've worked hard, you've started your own business, you've made money for yourself, you're doing well for yourself. And if you just have an emergency, you might end up losing everything just for one diagnosis or for one emergency. If you don't have access to private jets, you're not going to be able to fly out to see a specialized caregiver. And which should not be so. In a country of over 250 million people, access to good healthcare should be the norm. But unfortunately, people, instead of speaking up, will continue to self-diagnose and do whatever they need to do to stay away from the hospitals or to stay away from being sick.
Yeah, I mean, this is not exclusive to Nigeria. Even in the US, people are reluctant to go to hospital to seek for medical care because, that could mean the difference between you being bankrupt and not being bankrupt. You could access it.
At least the resources is still there. You can still get the care you need and then worry about paying the bills later. The bill, worst case, you can file a bankruptcy. You still have to live with a good health and you still have to worry about fixing your credit for the next 7 years. But you're still going to be alive to, enjoy life a little bit. But in Nigeria, the resources are not there.
Yeah, I
That's
definitely
the
agree
difference.
with you. For some people, they may actually die of the of the death before the actual sickness kills them because come on, man. If you end up with a $300,000, $500,000, medical bill, and you only make like $30,000 a year, that is a death sentence right there. So,
Of course, I agree, but there's also a way around that, right? There's bankruptcy to help you get rid of those debt, but we know if it's a student loan, it cannot be discharged, but every other loan can be discharged. At least you get a care. You still get to live maybe extra 5 to 10 years before whatever happens.
yeah, I mean, I definitely agree with you. You talked about access to, lack of quality equipment and tools to, properly do the job. Yeah, I think those are lacking. And I think for most people that are job buying, there's actually a need or they feel like they need to better themselves, continuous improvement, have access to quality equipment and the tools to better the job so that they can be at par with with their counterpart around the globe. And then I think that is a legitimate concern. And then for me, I would also recommend a better working condition. I think it was about 4 months or 5 months ago where they said a doctor actually died on duty. I think it was somewhere in Port Harcourt. He died on duty. He saw almost taking care of almost 30 patients, and he collapsed and died. And there was nobody to take care of him as he was taking care of people. So there should be a better working condition. I also know that because healthcare is cheap in Nigeria, if you can get it in Nigeria, that is why there is no good working conditions for doctors because it's very, very cheap. That is why a doctor is seeing 50 patients a night or in a shift. But in the US, I don't think that's the case. It's not cheap. So they have a better doctor to patient ratio in the US. So in Nigeria, I think they need to do better. The political class need to do better. I think the president should, either sign executive order mandating all the elected officials or government officials to use the hospitals in the country, even from presidency down to the councillors, to begin to use hospitals in Nigeria. Not until then, our healthcare system will continue to be a joke. And I think that is what the president needs to do, but there is no political will, so he wouldn't do it because he is a beneficiary of the dysfunction in the healthcare system. So he will not do it. Even apart from him, a lot of political class, will not, endorse that move. So our Senate president, allegedly, he's not well. He's been shuttling between Nigeria and London. If you make that kind of rule, it's going to be a political suicide for whoever that is coming up with that rule. So, but there should be something that they can do to encourage better healthcare in Nigeria. Let us know what you think. I honestly think that they can do better. And I honestly think that the president can sign an executive order mandating elected officials to use public hospitals in Nigeria. For my reason for that is because I think that when they do that, they will see the need to fix our healthcare system. But otherwise, it will continue to be a joke. Let us know what you think, and we'll meet you in the comment section.